Hey there and welcome. Today we are jumping right into a classic medical puzzle, figuring out the difference between a paralytic ileus and a mechanical intestinal obstruction. And getting this one right, well, it's absolutely critical. So picture this. A patient's gut has just stopped, completely ground to a halt. The big question we have to answer is, why? Are we just looking at a simple traffic jam where all the movement has temporarily paused? Or is there a total physical roadblock up ahead? Trust me, the answer changes everything. All right, so to crack this case, we've got to get to know our two prime suspects. Let's really break down what we mean when we say a traffic jam versus a roadblock. So our first suspect is paralytic ileus, and the key word to remember here is functional. Think of it like all the traffic lights on a highway suddenly turning red at the exact same time. There's no accident, there's no physical barrier on the road, but for some reason, all movement has just stopped. The intestine has kind of lost its mojo, its ability to contract and push things along. Okay, and then we have suspect number 2, mechanical obstruction. Now this is your total roadblock. In this case, there is a very real physical barrier blocking the highway. Something is literally in the way, making it impossible for anything to get through. So let's just boil it all down to the most crucial point. Ileus is a problem of function. The system just isn't working right. Obstruction, on the other hand, is a problem of physics. The path is physically blocked. And understanding that one difference, that's the key to the whole thing. So what could cause this kind of massive traffic jam? Well, a few things can cause the gut to just shut down. It could be the stress from a recent abdominal surgery, or maybe an electrolyte imbalance throwing the body's chemistry out of whack. Certain drugs, especially opioids, are famous for this. And widespread inflammation, something we call peritonitis, can also basically paralyze the bowel. And what about the roadblocks? Well, these are always caused by a real physical problem. You could have bands of scar tissue called adhesions that can literally kink the bowel like a garden hose. A hernia can trap a piece of the intestine. The bowel can twist on itself in what's called a volvulus, or a tumor could just grow large enough to block the path entirely. Okay, so we know who our suspects are and what might cause them. Now it's time to start gathering some evidence, and our investigation begins by listening to the patient's story, and then, quite literally, listening to their abdomen. So where do we start? Well, the very first and most immediate clue comes right from the patient. You ask them about the pain. You can learn an incredible amount just by understanding the nature of that pain. And believe me, the difference in the type of pain is a huge giveaway. With a paralytic ileus, the patient usually describes a mild, constant, sort of all-over ache. But with an obstruction, that pain is severe, it's crampy, and it comes in waves. We call this colicky pain, and it's the sound of the intestine contracting like crazy, trying with all its might to push past that roadblock. So after we've heard the patient's story, it's time to grab the stethoscope. We're literally going to listen to what the gut itself is trying to tell us. And this is one of the biggest clues you can get. With a paralytic ileus, the abdomen is just silent, eerily quiet. No movement means no sound. But with an early mechanical obstruction, you'll often hear these hyperactive, high-pitched, almost tinkling sounds. That's the sound of the gut working overtime, fighting against that blockage. All right, so we've got the patient's story, we've listened to the abdomen, but now it's time for the hard evidence. We're going to move on to the view from inside and see how imaging can finally reveal the truth. You know, there are a couple of other physical clues that can point us in the right direction too. In an ileus, the entire abdomen might be generally bloated. But with an obstruction, that bloating and any vomiting is often way more focused and severe because all that pressure is building up right behind the roadblock. But honestly, all of that is just circumstantial evidence. The real proof, the smoking gun that solves the case, is always in the pictures. And this is where the X-ray really tells the story. In an ileus, the film shows gas just spread out everywhere, throughout the entire bowel, small and large. But in an obstruction, you see a clear cutoff point. And probably the single most telling sign, you look for air in the rectum. If it's there, it's a traffic jam. If it's gone, you found your roadblock. Okay, so the investigation is over. We've gathered the clues, we've made our diagnosis. But why did all this detective work matter so much? Well, it's because the correct diagnosis leads down two completely different paths for treatment. And here's the bottom line. You absolutely cannot treat a roadblock the same way you treat a traffic jam. Getting this diagnosis right is the difference between simple supportive care and an urgent trip to the operating room. So if we're dealing with that traffic jam, the paralytic ileus, we take a more conservative route. We rest the bowel, meaning nothing to eat or drink. We might decompress the stomach with a tube, give IV fluids to keep them hydrated, and of course, treat whatever caused the problem in the first place. We're basically just giving the whole system time to reset and reboot. But for the roadblock, the mechanical obstruction, yeah, that's a completely different story. That often means one thing: surgery. You have to physically go in there and clear that blockage. And just like that, case closed. But before we put the file away, let's do a quick recap of those key diagnostic clues that helps us tell our two suspects apart. So here it is, the final report, our detective's cheat sheet. You've got the type of pain, the sounds from the abdomen, and the story the x-ray tells. Every single clue points right back to that one core difference we talked about, a functional paralysis versus a physical blockage. So there you have it. Now you have the framework to solve this really critical medical puzzle. The next time you come across a gut that's just stopped working, you'll know exactly what clues to look for. Which, just leaves one question. What medical mystery should we dive into next?